I wanted to give some tips for approaching clinical skills exams, OSCEs, and things of the like. So in terms of your clinical skills exam, which you will take as a graduation requirement towards the end of your medical school training, recommend preparation for that. First Aid USMLE Step 2 CS Clinical Skills book. You can find a copy of this on many student drives. It's floating around out there. Basically, all you need to practice and prepare for the clinical skills exam. So one thing I always wondered on these clinical skills exams is how you're evaluated, and I think it's important for knowing this. I think in the beginning I went in pretty blind, but it's helpful to know how you're being evaluated. And so in the clinical skills exam, they follow similar to how Step 2 CS is scored. You'll be given an integrated clinical encounter score, and then the other major categories of communication and interpersonal skills. So the integrated clinical encounter kind of revolves around your clinical knowledge and interpretation of that information. And the communication interpersonal skills is where SP evaluations and how you interact with the patient matter. So just kind of take a look at this and just briefly read through it just to see what are the key points that you need to hit for the clinical skills exam. The second part for preparing for the clinical skills exam is to anticipate potential challenge questions. In the clinical skills exam, you'll have standardized patients, and they'll often have some challenge question that's in there that you may be asked, may come up, or a challenging situation. And it's important to know what are the kind of expected responses for that and kind of practicing out for yourself how you would respond to that. See here on page 67, that's when they start. Find the section on the challenging questions situations and just read through these various questions that are asked by that standardized patients may ask you. It's very helpful for getting a sense of that. Practice it out for yourself. Kind of key tips for approaching this is that I often find the questions revolved around them asking about a diagnosis or an assumption about their illness kind of early on when you're taking the history. So my advice for that is to be honest and upfront and simply state that you don't have the information now, but you would like to know more and ask more questions. So I think one of the examples in here is, do I have cancer? Your response would be something like, either you could respond something, I don't have all the information to know for sure if you have cancer, but I would like to ask more questions to better understand what's going on. A challenge question can sometimes come up where they'll bring up something that's completely unrelated to the case, and or they might express emotions of anger, fear, evasiveness. And in those situations, kind of like that cancer question, like they weren't here for workup of cancer or something like that, and they bring that up out of the blue. It's important to ask why. So another response to that could be, why are you concerned about cancer? Can you tell me more about why you might think that? There's another example here. It's actually here. I'm afraid I might have AIDS. And then you could kind of expand and ask, why would you think that? If you haven't gotten to the sexual history part of things, it might evoke more history and more explanation of why they are fearful that might happen to them. So whenever in doubt, when something's off-putting or you're not sure why you're being asked this question, my best approach to that is ask why do you think that, why are you feeling this way, and then you can kind of better triage how to address the challenge question. The third most important part for the preparation for the clinical skills exam is to practice these practice cases. There's a wide variety of cases that are covered in this. So it's pretty helpful to grab a friend or family member to kind of act as a standardized patient for these cases. There's even, I believe, an SP version of this that you can give to the person pretending to be the patient. And ask them the questions. They should have a list of what their responses are to that here. So if you ask them what the chief complaint is, they'll tell you this. And this is the kind of guide for the standardized patient. And then on the flip side, you will be on this clinical skills exam writing your history physical exam. So you can have a notebook or a piece of paper. Actually, you'll only be allowed a piece of paper, so it might be helpful to just practice with the paper. See if you hit the correct things that you were supposed to get for this. And my general tip for the practice cases are to practice a wide variety of cases. Here they are. Practice some cases where the individual is elderly. They're adult cases, and there's only a handful of PEDS cases, so I recommend actually practicing all of the PEDS cases here, as they are very, very helpful. And in general, like a very general tip for just overall preparation for the clinical skills exam is to take this soon after or right before taking step 2 CK, as you will be at your peak knowledge for this. You'll less have to worry about that integrated clinical encounter component, which relies on your clinical knowledge and being able to accurately have a differential diagnosis for the chief complaint. Now I'll move on to the next topic, which is what you should do for the cases themselves. So I always recommend take 3 to 5 minutes to read the case. I've seen people just go in immediately after reading the case, but I am a person who likes to anticipate, and I find that works for me. So if you're very comfortable just going in without really thinking about it too much, and that's how you work, then do that. But I like to have all the information having thought about it before approaching the case. I recommend taking 3 to 5 minutes to read the case. An example, like in this one, is the chest pain. They'll probably tell you the age, what they're coming for, and they usually always tell you the vital signs. So these are the first things you'll read. I usually write out chief complaint and what it is, cut out this unnecessary content, sometimes it's longer, and then note the vital signs. And I always like to write, double check that they're not febrile, and write down any of the abnormal vitals. This person's BP is on the higher side, so I might note that there in the context of chest pain, which may be important. And while you're in this phase, I will demonstrate shortly the process for this, but I like to list out all the necessary sections for your history. That'll be important for the component where after your visit you'll have to write it onto the computer. And then the other part that I do is write out the differential, what I'm thinking about, and all the labs and tests I might order depending on that differential. So I'll kind of show that at the end of this, how that might work. Another quick tip for going through the case scenarios while you're there is that the actual time that you have is pretty short. I believe it's like 10 to 15 minutes or so there. So that's not a lot of time. So one way I found to shorten the time is to kind of rapid fire the review of systems questions. So you can ask a whole range of review of system questions. I often find asking just the most pertinent ones and rapid firing the rest are going to save you time. So you could ask a patient, do you have fever, chills, headache, vision loss, chest pain, shortness of breath, and then kind of take a pause and assess. In this case, they said chest pain. Maybe they have shortness of breath. And then rapid fire the other ones. Do you have pain with urination, leg swelling, muscle weakness? And kind of rapid fire those instead of stopping at each single one, which is what I used to do, and would run out of time for these. So that's a quick tip for speeding up, and it did save me a lot of time. Other thing that can happen is oftentimes you often feel like you're not sure where this conversation is going, you get lost, or you panic, or just need time to think about what's the next question to ask, which is often a problem that I've had. I found a solution to this is to just summarize. So that means just summarizing what the patient has just told you. Kind of ask them, in addition to that, is there anything that you feel that we didn't cover that is important to discuss? So that leaves it open for the patient, the standardized patient, to sometimes bring up extra information that you maybe forgot to ask the location, and they might bring it up then, or they may describe some type of social situation that was important, maybe for the challenge question or something for that case, that they haven't brought up. But whenever in doubt, just summarize. It gives you a moment to breathe, gives a chance for the standardized patient to give you information that could be critical for your diagnosis differential. And then in the case, you will get a 5-minute warning. Use that as a cue to start wrapping up. So some tips for that are to use non-medical terminology. I found that you may be asked, well, what does EKG mean? And I think that was an example in one of these, for the standardized patient ask you. If you told them EKG or ECG, they might say, hey, what does that mean? And then you'll be prompted to explain. So your best bet is to just explain what the medical terminology means, or use non-medical terminology. And then secondly, the second component to that is let them know what it could be. So you could say, I'm most concerned about this X, Y, and Z. And then tell them the next steps. It even kind of gives an example here. So follow-up test that you would order. Ask them, do you have any questions, concerns? Give them a time to bring up some things. Oftentimes they might ask something about the test. Like I said, if you said, I want to order an EKG, they might be like, what is that? What does that entail? And you'll have to kind of guide them through that. And then as part of the closure, the last few statements you want to make, you can offer an appreciative comment, like, appreciate you for coming in. Let's get these tests done. Does that sound like a plan? Sometimes I might end it with, let's plan on meeting with you to discuss the results. So those are examples of some things I've said to kind of close the visit and then leave the room. So you're allowed a paper in the clinical skills exam. And so it's a normal 8.5 by 11 paper. And so when I'm approaching these clinical skills cases, I'll have the paper and I'll draw a line like a cross, and then draw some diagonals. So you have these kind of 8 compartments here. And these are in this 5 minutes that I was describing that you have before popping into the patient room. And so I quick draw this. And then this you kind of have to practice beforehand, and kind of you should kind of already know a little bit of the structure of an exam. But especially for a clinical skills exam, it's very standardized. It doesn't always mirror real life or real kind of experiences you might encounter in the hospital or outpatient setting. It's very different. So it's important to just practice this before doing this clinical skills exam. So I wrote out here components of a history. And also because my handwriting is not that well, I'll be doing it on PowerPoint. But I have this kind of set up here on paper that I've drawn out, and I'll note the compartments of what I want in this. So HPI, review of systems, have my past medical history here, surgical history, meds and supplements in one, allergies over here, and family history, social history. Okay. And then, like I was saying earlier, up top, I like to write the name briefly. Let's say this is Mr. Smith or something. Age, 45 male. And then I usually note he's afebrile, and I'll write down whatever things abnormal. This guy maybe has a high blood pressure, for example. And then already I'll write out, let's say his chief complaint is chest pain. And then already I'll write down kind of a differential for him, what I'm thinking of off the bat. MI is the big thing to rule out. It's very critical. Let's see, other things. You could have a pulmonary embolism, pneumonia, a GERD. Just list out things you could think of that could create chest pain. Some of these things might be unlikely, but important to suss out based on the history. So another thing I like to automatically already write in here, I still do it sometimes for kind of one complaint type things, especially for the clinical skills exam, is old carts. I've been using it since day one, and it's always had my back. So I always kind of write out old carts just to remember key components of parts of the history. That's just easy for me to look out and try to get in there. And now for this, I also like to kind of preemptively kind of jot some important review of systems questions. I kind of go from like head to toe, but you can kind of practice on your own which ones you think might be important. And like I said, quick rapid fire these. So let's say it's headache, you want to know cough, shortness of breath, maybe palpitations, diarrhea. And I have these as a little checkbox to make sure I got them. I just can't do it in here on PowerPoint right now. But like I said, rapid fire these. Maybe you want to pause on shortness of breath, just because it might be relevant in the setting of chest pain. And past medical history, kind of self-explanatory, just ask them. Same thing with surgical history. And also meds and supplements. You might want to assess in this one compliance, like if they're taking their medications, any issues with them, supplements of the like. And I would say the most important one in terms of clinical skills exam will be the social history. A lot of challenges questions kind of pop up in relation to the social history. So you want to ask about alcohol use, smoking. You can ask about occupations. So those are kind of some of the basic ones. But you could also preemptively write these as a reminder. Sometimes I did for these just because I have been historically before that point forgetting the social history. But it is important to for this, like in the context like smoking, maybe even exercise, occupation might be important for this. So you can write it out here. But my favorites to add are old carts and some of the ROS systems, which I often forget to ask or forget in the moment what to ask. But this is kind of the setup I have already. And in addition to this, sometimes I like to write out already what my tests are going to be. Definitely want an EKG, chest x-ray. Those are probably the big two that I'll probably do for sure based on this complaint. And so I like to do this beforehand just because it's easier. It's less thinking for me when I'm in there, as I just narrow it down based on what they say on this differential, what's most likely, and I already have thought about what the test might be. So you kind of already know what's happening, and all you need to do is just fill in the blanks with some of this patient history just to narrow this down. Okay, well, that's it for the example. I hope this helps you on your clinical skills exam. And it's just all about practice and being comfortable with this particular format. Again, it doesn't necessarily mimic your experience in the inpatient or outpatient setting. It's just very much a unique setting that you had to hit the check marks that they're looking for in a very short amount of time. Definitely a kind of different experience than you may have experienced before. But if you practice these kind of quick tips and tricks, you should be able to get it done and hit the points that they want you to cover and do it in a timely manner. Great. I hope this helps you.